I've done my master's in pediatrics back in India. So following that is where my journey into the UK began. So I've been working in the NHS for the last 2 years as an international trainee fellow in pediatrics. So the pathway through which I could come through is something called as the MED program. It's a super specialty program. There are it's got a lot of academic writing and academic part to it, and as well as a clinical training. So it's associated with Edgell University and the WWL Trust. So they merge together, they come over to India and they conduct a set of interviews and they select candidates to come through this program. So we're basically part-time university, but then most of our work is just in NHS, and we are on a full-time rota and we work in NHS. I'm basically working as a middle grade registrar in pediatrics. So far, it's been really good. Definitely a big change moving over to a different country and adapting to the work style of NHS. So I'm happy to talk to anybody who is wanting to pursue a career in NHS or trying to move from anywhere else abroad to work here, not just through this program. They can ask me about MTI or PLAB or whatever means they're trying to get through, especially for specialty training.
Mm-hmm.
Yeah.
So while we're just waiting for questions to come in, I'm really curious about this. So I always ask this to any doctor because I'm a third year medical student. So I'm sort of now thinking about the future and where I'll end up. So one of the questions I like to ask people is, why pediatrics?
Yeah.
So why this field?
Throughout your undergraduate medical training, at every point of time, you start developing interest in various specialties. So probably the best time where you can decide what you really want to do is your FY year. That's when we've got something called as internship. At the end of 4.5 years, we've got 1 year of internship. That's when you get to have a hands-on experience of working with the team, what it's like, and are you able to cope with the demands of the long hours? Do you want to take such kind of pressures? Is that really your passion? So it's an individual choice whether you want to be a surgical person, whether you want to be a medical person. But then FY year is a crucial year for you to make a call what you want. For me, it was basically I knew I wanted to be in a medical stream, and I think I had, to be fair, I had great professors of pediatrics. My undergraduate training was excellent, and probably working with the team and that kind of brought in that interest from the beginning, and maybe that's why I chose it. And I've enjoyed it throughout so far. To be fair, at one point of time, I thought that probably I want to be a dermatologist, have a nice life, 9 to 4. Not have any sort of emergency, do some cosmetics, some laser, treat something, and then it's a good work-life balance. But then at the end of it, the passion, you see, I really don't know how happy I would have been doing that. So it's very rewarding to be a pediatrician. I think there's a different level of connect you have with families. That's because unlike adult medicine, you always get involved with parents and children. And I've always seen that pediatricians are very good at communicating, talking, more empathetic. So I love this part of being together with people and helping children get better. So but then there are the other side of it where you've got your night on calls. It can be stressful, the long hours. It's a part of it. So it's how you can balance. I think it's much better in NHS compared to what I worked back home. You've got good working hours. After a 12-hour shift, you're not expected to come back. You hand over your bleep and you go home. But then, there's somebody asking. But then back home is not like that. Somebody's asking, is working with the NHS very rewarding when it comes to helping people, or is it more emotionally taxing and stressful? I must say that working with the NHS has given me a very different perspective about patient approach, about how much of time I spent to towards a patient. And I feel it's more of a holistic approach here. I've always felt that everybody has been treated equally, everybody is given equal opportunities to get care, and I definitely feel it's been more rewarding for me compared to the number of people we would treat back home in a little span of time. For example, one clinic, an hour clinic, you will have to finish at least 25 to 30 patients. Can you imagine how much time you can give to each patient in a clinic to sit and talk, to understand, and to actually communicate back? It was more like a monologue. Okay, this is what you've got, this is what you got to take. Okay, you can go, the next person come in. But NHS does never do that. NHS makes sure that, the patient is the priority rather than anything else. And that's something I will carry on throughout my career, that to give enough time to talk enough, and then to make sure that they're well understood rather than just prescribing something. Yeah, and
No, I
stressful. At
completely
times
agree
it
with
could be
that.
stressful because the field is such that there will be challenges, and people are always impatient. They don't want to wait long waiting hours, and you're held up somewhere working, and probably, especially with little ones, getting lines and cannulas. Maybe it doesn't happen at the first go. Child is apprehensive, crying. Parents are worried. So yeah, some sort of conversations with parents at times could be stressful, but then if always handled calmly, I think it works out fine. Do we have yeah, I think it would be helpful if you've got international graduates, if they're on a platform, so maybe they would get more information from me about logging in.
More out of it. But just sort of in general, how have you found the sort of support network, or how have you been supported as someone who's come and studied internationally, but sort of integrating into the NHS? How have you found it, and how sort of easy or difficult was it for you to sort of
To be
assimilate into
fair,
a
when I
team?
started, in spite of being qualified as an ST5, I started my journey as an SHO. I'm happy I did that, because that's very important to know the working system here. That's very important to uh, to kind of get adapted to the team, to know whom you're working with. There are lots of anxieties and apprehensions when you start working in NHS, because when you go through all the stories with GMC, you're always thinking, are you going to be held responsible for something legally? So in spite of being enough experienced, you always think twice before taking a decision confidently. These are all the things that happen in the initial few months to get adapted. But then I must say, I'm very lucky to the team that I'm working in. I work in Warrington Hospital, and from my colleagues to the consultants to the nursing staff, they've been extremely helpful, and everybody has kind of helped welcome me into the team very well. It took about 3 to 6 months working as an SHO, and then it's been fantastic after that, stepping up to the middle grade. I think I'm more confident, and that time period was crucial to step down and go to a SHO level and understand the system of working. Even with clinics, I would only shadow the clinics initially to see, it's not just about medicine. It's about how do you dictate your letters, how do you communicate with patients, and what sort of documentation is needed. All of this is not probably a part of training when you learn medicine elsewhere, but it's very important in the NHS. So it gave me a good amount of time to adapt, and I'm at a stage now where I can do my independent clinics, and I'm pretty confident to manage. I must thank my team for that. So I don't know if everybody will get that opportunity, but then I believe most of the places are really good. How has it been being a medical student for you? Yeah.
Oh, in the COVID era of, it's, to be fair, it's okay. It's better than I thought it'd be. I thought it'd fully be online, like Zoom University. There'd be no sort of medicine part of it. But our unis tried their best to keep uni open. So I have to go in once a week, but in that time I do clinical skills and I do my dissection.
Yeah,
So they've tried
dissection
to
should be
fit
very
in
difficult
as much
online. I
as they
think
can.
one gets on is
Yeah, dissection would
yeah,
be very difficult to do on a 3D online model, but we like our
yeah,
uni was prepared enough that we had all of our
yeah.
cadavers because we have the soft teal cadavers, mostly from
Oh,
Dundee, but our uni was
okay.
prepared in that they had extra
That's good. So they were
cadavers. So
prepared
when
for
we
it.
came,
I think
there was
Charlotte is
enough.
asking
Yeah.
me, do you work with many
Yeah.
dietitians in your job? Well, my specialty training is pediatric diabetes. So I'm working with the pediatric diabetic team, and I must say that we work as a team with specialist nurses. We've got a dietitian, and we've got the consultants, and the trainee with them. So yeah, it's we've had two full-time dietitians in our team, and yeah, it's been a great experience. I have had quite a few sessions sitting with them, discussing with families. It's been really good, but both of them have been the local dietitians. I've not had a touch with somebody who's international, who's worked elsewhere and come over. I'm not sure if Charlotte wants to know anything more about dietitians, or is it just a gentle question? Um, there's Kush who's telling me that would you agree that there is a certain amount of wastage of time within the NHS system as compared to systems in developing countries? Interesting. Repeated checks, which could be streamlined to make things quicker and more efficient. Well, I definitely partly agree with Kush, because the system is through GP service and through specialist centers like the DGH, and then you get referred to tertiary care. This is how the pathway you'll have to follow. I guess in this course of time, there's quite a few children who could have been seen earlier, who could have been referred earlier, kind of get delayed because of the long waiting list that's there for clinics and or for any sort of investigation that's needed, unless and until it's an emergency. Um, um, Comparing this to the system back in a developing country, the only difference I would say why it's easier there is because there's private practice everywhere. So if you can afford, then you can get treatment immediately. But then NHS is not that. NHS is a centralized service-based health system. So children, everybody pay equally for it, and everybody have to get equal opportunities. Definitely, if there is a capacity to increase number of clinics or capacity to increase the number of people that can attend to these investigations that needs to be done at the right time, then probably this wastage of time can be prevented. But I don't know how that can be efficiently done. But I do agree that there is certain amount of waiting. For example, murmur clinics with children who've had a murmur, it could be still innocent, it could not be significant, but then the anxiety the parents have until to wait for 6 months to get to a clinic to get an echo done. So that is something stressful to families. Hopefully, things will get better, and there'll be quicker turnover of patients. Charlotte says about dietitians. With diabetes, so basically we deal with carb counting and exercise and how it can affect their glycemic control. So when patients come in, we do joint clinics. We do clinics where the patients will meet the specialist nurse first, get their downloads done, and then they talk to the dietitian about about the carb counting, and then she goes through them, and then she comes into the consultant's room to see what their numbers are and what changes we could do. I don't know if Charlotte wants to know about the training as a dietitian point of view, because I'm into pediatrics. I'm unsure how the training is in the UK, and what roles they have and what are the requirements. But then if she's interested to know anything about pediatrics, probably I can tell her more. Do you know anything about dietitians, Tanisha?
I feel like I should know more than I do, but we don't unfortunately, I guess that's one of the sort of downfalls to medicine, is that we're so focused on medicine, and we understand the sort of concept of MDT. We only ever get to see, but now because of COVID, we're cutting back on placement. It's harder to see sort of like nurses, like healthcare workers, physiotherapists, dietitians, to see them all in their natural habitat, which is the hospital. So I guess it's really hard to. But I guess if you did want to know more about sort of dietitians, the career paths and how to do it, I'm sure the NHS careers website would have information. And also if you look at like nutrition and dietitian courses, you can find out things like course modules, so what the sort of curriculum looks like. You can find information about entry requirements. And if you do look on like platforms such as the Student Room, I don't know if that still exists, because me applying to uni was a long time ago. But the Student Room is a really good platform for you to find personal statements, just student perspectives on the course and the career itself. So do try. The internet is a vast space. You can find quite a lot of things there. So do just try.
This was good information for me as well. Looking through the Student Room, is it something you get to do just before entering your university?
Yeah, so I think I was first introduced that because I did an undergrad. So from 2015 to 2018, I was doing medical genetics, and then I came into medicine. So back when I was applying, I heard through a friend that this website exists called the Student Room, where they had people's like personal statements. They had like a bank to help you write. Then each would have their own sort of page where you could look at their entry requirements. You can sort of compare which uni is for you. It'll tell you what type of course they did, what students thought about it, like the sort of unfiltered opinions of a university you could find on the Student Room. And it sort of gives you the things you need to know about a uni, like nightlife, like whether it's friendly for students, whether the lecturers are nice, whether the course is actually worth it. So that's why I was sort of introduced into it. So when you're sort of narrowing down your options of,
it's interesting that you get a perspective, about things even before you choose it. So yeah, it's very helpful that you've got opportunities to get to know things before you go into it. Yeah, Charlotte, say.
Yeah. I guess this is why, like, oh yeah, thank you, Charlotte. But this is why, like, people like you coming to talk to us, like, I've got notes down. I'm learning things from this as well, even though I'm moderating it. But I know, like, a lot of people, like, for this is their exposure to the field of healthcare that maybe they wouldn't have got because of COVID. And a lot of them have been talking about lack of volunteering, lack of work experience. And so they're sort of looking at you as mentors to tell them a little bit about your career and sort of like an online work experience, essentially. Does anyone else have any questions about working in the NHS? Because if you guys don't, I have plenty of questions to ask. So I could just fill in the silence. But if you guys have any questions of how like the NHS compares to an international healthcare, how like just the field of pediatrics, because we have an expert pediatrician with us. So if you do have any questions, this is the perfect.
Have you developed an interest in any subspecialty?
This may sound biased, like, but pediatrics is one of my top 3. People have always said I have the sort of chaotic energy of a pediatrician. She was like, people are like, kids will love you because you're crazy. And so I've always wanted to go to pediatrics because it just seems, I guess, like that's the positive side, that you deal with the most interesting people, which are children. But then I guess people need to understand that it's not sunshine and rainbows. If you're a
that's
pediatrician,
what I was going to
children
say.
aren't seeing you
A
because
lot
they're
of
healthy and
people
happy.
have this misconception that,
There
well,
is,
I get along with children very well. I like them. It's nice to be around them. But the reality is, you're not around happy-go-lucky, nice, bubbly children. You're around unwell, sick children. So it's about whether you're okay with handling things which could be emotionally very draining, because lots of my colleagues who wanted to take it up refused, because that's one aspect with children. When you get emotionally attached, it's very difficult to deal when they're unwell, sick, and when you know that the diagnosis is going to be poor. So yeah, those.
Yeah, I guess that's like also like my
Right.
second option is oncology, which again, like pediatrics, they're not seeing you because they're well and they're happy. But I think that's one of the things I wanted to ask you is that as someone who deals with children who may not be able to sort of fully understand what's going on, and like I don't want to like be patronizing and say that they're stupid, I'm not saying that, but like they won't be able to like fully understand what's going on. How do you take that into consideration when like breaking news or when having like the tough discussions with them? How does that affect you, and sort of what's
I
your
must say
thought
that
process throughout that?
the beauty of pediatrics is that you engage with parents from the first minute they are in the hospital. So it's not like adult medicine. You're treating the individual, and only when you need an opinion or you need a consent or you need to break a news is when you're getting involved with the attenders. So you are with them from the beginning of, since history taking till whatever progress happens. So to be frank and to be fair is very important, no matter how harsh the reality is or how harsh the prognosis would be for the child. We all tend to look into things which can be rectified, which can be corrected, but unfortunately there will be times where it's too late, or probably we haven't got a cure, or it's just one of those things where parents need to accept. I must say that here there's a lot of support from the community. There's a lot of palliative care treatment, and there's huge MDTs for chronic diseases or even for end of life care. So looking at that positive perspective, when you tell parents in the right attitude, and with the right information they need to know about all the pros and cons, most of the time they are disappointed, they are upset. I don't deny that. It breaks their world, and they don't want to hear this. But then they all cope with it because of the kind of support they receive. That's something I've appreciated very much. Um, I mean, from the training where I've had back home, looking at how it is here, I'm very impressed about how various different teams work together for a betterment of one child. So things are a lot more easier to manage here compared to a developing country any day. The other thing I would like to tell you is, you mentioned about you liking oncology and you liking pediatrics. So pediatric oncology would be a very good subject for you, for the reason that I must say that most of the pediatric tumors have better prognosis compared to others. So probably you might find that to be rewarding and not burnt out like other oncology. And they do respond well. They do have better prognosis if treated early and intervened early. And you may enjoy that. You can consider thinking of it. Yeah. Yeah.
Sort of the best of both worlds, essentially. But sort of like, just because I know you mentioned just about like your career and how it's different between the two, sort of what brought you to the NHS? What made you want to move your entire life from one
This was not a
continent across the
professional
world to
decision
the
for
other?
me.
and sort of,
I must say
yeah.
that I wasn't looking forward to move out of India because I was pretty comfortable. I've adapted to the work system there, but then I was married to somebody who had to move into the NHS, so I had to follow him. That was what
Yeah.
happened. So my husband wanted to come over here. He's an orthopedic surgeon, so he wanted to be trained in his hip and knees, plasties and scopies, and all his senior consultants and professors back home were all trained in the UK. So they had told him that he needs some amount of training and exposure here. So that's when he moved, and then I had to follow. So that's what happened. But then I will say that apart from that, it's been a really good experience, and definitely I have changed my practice. When it comes to medical knowledge and skills, I must tell that I was trained very well because the training is very intense back in India, because a specialty training is only 3 years, unlike the 8 years of ST training here. So in 3 years, it's you got to complete all your training, and it's very theoretical. The number of patients are more. You get to do lots of hands-on things. So in that aspect, it was very good doing the specialty training back home. But then there are soft skills which nobody talks to you about. Nobody teaches you about communication. Nobody teaches you about introduce yourself to your patient first, like a basic thing, because probably there's lack of time, or probably that's not been given enough importance. So a lot of other skills I've picked up here through my journey. I must say that it has probably completed me as a doctor working in the NHS, and I will value this and take it back wherever I go and work. It has had a major impact on my practice. Yeah, and the other thing, what I really appreciate here is protocol based, and everything is evidence based. It makes life easier when people are working on the situation wherever they are in A&E or ICUs or the wards. Everything's got a protocol, and you don't need to remember everything, know your textbooks, and it makes easier to reduce errors and mistakes so that you have something to check on and you can implement that. There are lots of positive things I can say about NHS, to be fair. It's been a great experience. I would recommend international trainees, if they want to come here and just have at least a couple of years of experience just to fine tune themselves. It's like a finishing school, I can say, where people would just go to get finished and go back. So I don't definitely there's lots of intense training and knowledge and skills back in India. Training is really good, doctors are excellent, but then the finishing is when you come into NHS. And me working in the diabetic team, I have been really amazed about the technology, how much that's been involved in diabetes. So we've got children on pumps, we've got children on intermediate glucose monitoring machines like Libre. We download their values. Life's made so easy with so much technology being involved. And if you think of it, NHS sponsors all of this free for all its patients. So that doesn't happen elsewhere. So I must say it's a boon. Yeah.
I just find it really fascinating how people can go through two different sort of schooling systems, like Indian medical school and like UK medical school. And so I just wanted to ask, like, do you think it's a good idea that, like, the opposite way around, like someone who's studied in a British university, do you think it's a good idea for someone like us to have exposure to different healthcare systems abroad?
I would definitely
Do you
agree
think
on
that would
that point
improve
of
us or help us?
what you're telling me. I said this is the finishing school the other way around, but definitely when I see how much about the training and education, about how it is with the basics of medicine, I think it's really good to do it back home. Given a choice, I would want to do my undergraduation training back in India rather than here. I know there's not lots of pressures, and it's a very it's an approach which is very well looked into, and you've got your limited subjects and your rotations and postings. It is intense back home, but even though it's intense, you learn a lot. you're more knowledgeable, and you've got more skills because you are forced to do all of that, whether you like it or not. I think that basics has helped me be a better clinician. That's definitely had a strong foundation in my clinical practice. So that's something I would definitely not want to do anywhere else. And I was very happy with the training what I've received. That's made me more confident, in fact, to come over here, adapt to a new system and function. So from a training perspective, definitely I would recommend going over and probably doing like an exchange program. I don't recommend anybody doing undergraduate medical training from here, going to India and doing a specialty. Definitely you won't be able to cope with the kind of stress and the intensity there. But then I would recommend an exchange program or an observership, or probably a 6 months to 1 year working in a healthcare sector, because of the variety of cases you will be seeing, because of the fact that you will be let to touch, talk, and deal with patients yourself. In spite of being a medical student, you can assist surgeries, and you can get everything hands-on. So yeah, as an FY2, you would have, I mean, if you're in the right place with lots of patients, probably you can do your own deliveries, episiotomies, assist cesarean sections, and do all of these things. So opportunities for these are better. So it's worthwhile if you get an opportunity to go and at least do a 6 months to 1 year of a training or an internship. It will be fantastic. You'll get a better experience. But then
that's really fascinating to hear, because I know that UK medical schools have electives where you can go abroad. I mean, a lot of medical students use it as an excuse to go on holiday for a few months and go backpacking and meet the elephants. But I feel like it's a really important sort of learning opportunity, because one, it makes you appreciate your education, but it makes you understand that each sort of country has its own healthcare system which works for them, and they all have their perks. And so if you can get that sort of exposure, you're only ever improving yourself. You're only ever improving your career. So you know what? That's actually sort of reinforced the idea that I do need to do an elective.
It is very beneficial, because you will get your own perspective of how is NHS and how is it there, and you get to learn and unlearn a lot of things. So that's what's happened with me. I had to unlearn a lot of things when I came here and got to learn a lot of things. So it's a process of learning, being a doctor, no matter where you are and how high you are in your career. But then it will definitely help. I do agree that it will help. We've had quite a few international medical students coming over when I was in medical school to just be a part of the clinical posting and work in the hospital, and they've all enjoyed it. And I know only because they get these opportunities to do things hands-on, which they don't get as medical students elsewhere. Don't know. There's nothing more. Do you want to ask me anything else?
I see, that's the thing. I told them to ask questions, otherwise I'll fill the silence, because I'm always curious. Because to me, you guys have made it to the other side of graduation. And so my question is sort of, I know they say that, like, this is to people listening as well, you'll learn that medicine, your degree isn't it. You spend the rest of your life learning, you spend the rest of your life improving yourself. There's always something to do. There's always something to do better. So for you and your sort of career trajectory, sort of, where do you see yourself? And sort of, is it the same as an international person coming in? Is it the same as someone coming in directly from the UK into sort of pediatric diabetes? Is it the same? Does your career end up in the same place? Is it sort of the same timeline?
If I practice in the UK, then probably I'll have to go in the same timeline of the UK trainees. If I want to, get into the ST training program or take my pathway to the Caesar route to be a consultant, the timeline would remain the same, and my requirements will be the same as a UK graduate. But then if I want to go back home, things would be different, because at the end of 3 years of training, you are allowed to have your own private practice, or you are allowed to have your own consultation, because there's only 3 years of specialty training. And to add it on, I've got these 2 years of subspecialty in diabetes for now. And since that's been my special interest, when I go back, I can practice as a pediatric diabetologist, by setting up my own center. But then I'm going to face a lot of hurdles because I don't have an MDT team like I do have here. So I'm going to be a doctor, I'm going to be the specialist nurse, I'm going to be the dietitian, I'm going to be the psychologist. So I'm going to play everybody's role and listen until I find somebody who's trained and who can fit in and, put all of these things. It's going to be even more challenging with technology as well, about the affordability for that matter, because these are all very expensive. Insulin pumps can cost about £4,000, and that's like a good amount for an average middle class or an above middle class to afford. Rather than that, probably they might just stick on to the MDIs and subcutaneous insulins. So all of these is a thing to balance. So I really don't know how much it can be implemented, but I do hope that when I go back, I will get enough support to probably I can find like-minded people to start something which we can help these people change.
Find a group of people who came
That would
to
be
the
great
UK,
if
just
I could
all
find
leave
people who've come in
together,
to become
start your own
dietitians, who've come in to
practice.
become specialist nurses, so I can team up with them and we can all go back together and practice. But then again, it's a big country. You can be from different parts of the country. You may not want to stay up in the same place and practice. So
leave
yeah,
at the same time.
I don't know how feasible that is.
Yeah. 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 So with you qualified as a pediatric doctor, and then you did your subspecialty, which was diabetes. Why diabetes?
As I was training, I saw a lot of children in DKA during my 3 years of training. So these children would come off of their DKA. They would be transitioned into their routine insulin, but then they would always be referred to adult diabetologists to be managed. So I always thought that there's definitely a difference in managing an adult and a child, and parents had lots of questions about their future, about the child's lifespan, career, whether they're going to have infertility. There were lots of questions, but then there was no specific specialty we could refer to, or nobody could answer, because diabetes is kind of an adult dominant thing, and it's all been seen by adult specialists. So when I came over here, when I started working in Waddington, I realized that they've got about 150 and odd patients, and then there's an exclusive diabetic training. Then I thought that's something where I've not seen, where we could not refer back. So probably if I train, and there are quite a few people who are trained now and who've got setups elsewhere, so it might make a difference, is what I thought, and that's why I chose it. And it's always been good because it's a long-term disease. You develop a connect with the family, and it's a bond. And when you transition them when they're about 18 years, you kind of don't want to let them go, because you've had this connect with the families. You've been treating them for so long, and it becomes an extended family, to be fair, when you keep dealing with these children for long term. So if you can treat them in the right way, that is something which can help them have life near normalcy. They don't have to have complications. They don't have to think of not having all the career choices what they want to do just because they've got diabetes. So that's the reason why I thought, fine, it's not been very well established, so let me learn and go back and probably bring about that awareness that it can be managed better.
Oh, sorry, that was just nice to hear, because it's like when you hear people passionate and are so sort of and engaged in their field, it's really inspiring to see, because you do it for the right reasons. You're doing it because you know that there's like a deficit in that field, and you sort of understand the positives. Like you get to make, but you get to bond that the patient doctor interaction that you have that extends beyond the patient, which you don't see that in adult medicine, acute medicine, emergency medicine. You don't see it stops at the patient. That's about it. Family history, that's as far as it goes. But when you're working in pediatrics, it's a whole web. There's so many more people involved. And so I just really think it's really fascinating to see just how like deep rooted those networks and how important they are, and how much of a role they play in sort of patient management, because it's not just the disease. The children are never just the disease. It's the child themselves. You have to think about quality of life expectancy, complications.
Definitely.
You have to think about like, everything in the long term. So I think pediatrics is like the fascinating. Like the most fascinating.
I was very impressed by the functioning of the team when I just got to know that we've got specialist nurses. When children are diagnosed, they go to school, they train the school teachers, they go home, they do enough home visits to sit in the same atmosphere, which is more comfortable for parents to learn. Because when somebody is diagnosed of type 1 diabetes, it's so much of information that's bombarded. What is diabetes? What do you manage? How do you do insulin? What do you do with blood sugars? What do you do with carb counting? How do you treat your hypoglycemia? What do you do your corrections? I mean, for a parent to accept the diagnosis and learn so much of science behind it and do it in the right way, it's very taxing, and it could be extremely stressful. But our nurses do a fantastic job. They go to the school, they teach the teachers, they train them. They make sure that they are in practice with it by doing it at least once in a week. And the children have a different kit in school, they have a different kit at home. So it's all been so well supported. That's something I was so impressed about. It's not just about coming to clinic, coming to hospital, one time review with the doctor, and it's all done. It's about going back to their house, going back to their school, and being with them when they need. I hope this can be implemented when I go back home, because that's very, very important, because they're so little, they don't understand the need support. I hope I will be able to do that.
No, and I'm sure you will. You're so motivated and driven and sort of passionate about it. I'm sure you will, because when so we did our endocrine module last year, and so that's when we sort of covered diabetes, pediatric diabetes. And I guess when you don't know about it, you're not really aware of the fine tuning of the field. Like I'm lucky enough to not have diabetes, so I don't know what goes on behind the scenes. But talking to you and sort of learning about it, you learn that it's not just the traditional doctor nurse. That's it.
No,
there's so many more people that play a role, and your care doesn't stop at a hospital. It comes into the community, and like you said, with the nurses, they'll go into your school, they'll come into your home. And so I guess that's just like the sort of brilliance, and what makes the NHS so amazing is that it's so holistic, it's so broad, it's so widened, that care will continue across time and across geography at this point, because they're coming into your home, clinics. So
it's been an amazing experience. I would definitely recommend anybody who wants to come and experience this. This will add on to the values probably they learn, and add on to how to treat a patient, looking into everything and not just patient or the disease itself. It's been great for me.
So if you could tell me like the 3 best things about being either in the NHS or a pediatric or pediatric diabetologist. I see pediatric diabetes doctor. I'm not going to try and speak the English, but so if I could like 3 things that are like the best thing about it, what would you say?
I must say, the first best thing for me is when they get better and when you've spent your time to make them feel better, and when they come and say thank you for doing so much. Yeah, that's the most rewarding thing, and it's very pleasing. So at the end of the day, the job comes down to that, when you've brought a smile on somebody's face, or you've really contributed in your own little way to make somebody's life a little better. So that's the point number one for me, and I think that doesn't hold only to pediatric diabetes or pediatrics. I think it's general about being a healthcare profession, be it a doctor, a nurse, a physiotherapist, a dietitian. This is the I think most of us choose this profession because we are individuals who like to make sure that somebody else is being benefited and somebody else is happy because of your little work. That's point number one. And point number two is, the best thing for me so far, working with the diabetic team, as I said, is I've already mentioned, I can never ignore the fact about this holistic approach, what we can give a patient. So that's something that has made a huge impact on me, and I am extremely impressed, and I want to take it forward and do something about it. And point number three is, working in the NHS, especially, is the atmosphere of work itself. There is no hierarchy in the medical system. So that makes you work in a stress-free environment, be with your nurses, be with your colleagues or your consultant, or with your healthcare assistants who work in the ward. Everybody's treated equally, and there is no hierarchy. That is something we see very, very prominently in the medical field. I don't know about other countries, at least from the place where I come from. There's a lot of hierarchy, and there's a lot of seniority complex. And in a team, when that comes in, I know experience matters. I know being a senior is always an advantage, but then if you've got a little bit of barrier, your team can't work together. You should have that, the freedom to express what you want to do, the freedom to be able to say that probably this would be better, why not this? And that's something I really enjoyed here, that there is no hierarchy in the system. So these are the three things which has actually impressed me working here, and probably will try to carry on, that it can make a difference.
Yeah. And so final things, because I feel like I could just keep talking and I'll keep you here forever. Just to give the people who are coming onto this course, this conference, any sort of words of advice you can give them, because they're all sort of looking at the healthcare field, the massive field, but they're all sort of looking at it in a careers perspective. Sort of, what advice do you have from them? And do you just have sort of just anything you say that you think make a decision or just apply, or anything?
If you're already a medical student, and if you're trying to pursue a career in a specialty, I would definitely advise that identify what your interests are, identify what your passion is. And once you're sure of that, and then think of a specialty what you want to pursue your training in, because be it any field of medicine, could be very stressful, could be very frustrating, and if you don't like it, and if you don't have a passion, it's very difficult to excel, or very difficult to cope with the working atmosphere and to give your best. So, and the best way to identify is as I said, your FY year, where you get to rotate amongst different placements. So you get an experience of how it is to actually work there. And if you think you like something, I would definitely advise to take a little bit more longer to work in that specialty, to know whether it's actually what you want to do, because it's very important to understand what your life ahead would be, because you're going to be in that specialty for a very long time. The second thing about people who have not joined into medical school yet, who are just looking forward to join university and want to be a part of medical school, I must say that they should look at pros and cons of being a doctor, or taking up medicine as a profession, because it's a long-term thing. You will have to dedicate yourself a lot of time and hard work, and it's a long process. And compared to lots of other professions, it can be a bit difficult to balance your work-life balance. So only if you're up for it, and if you think that is what you actually want to do, and only then take it up. Otherwise, it can again put a lot of stress on your mental health, and you start comparing to various other fields where people are engineers, chartered accountants, they have short education times, but then they start earning more, they start having a better life. So when all of these pictures come into place, and then you think, why am I doing this? So it's about understanding the whole approach about what's going to be 10 years down the line or 20 years down the line, rather than just thinking I'm going to do medicine now. So these are the two things I might want to tell to people who want to take up a career.
Yeah. Does anyone have any questions? Give it a few seconds to see if anyone does. I feel like I've just been enjoying this question and answer.
I've thoroughly enjoyed talking to you as well.
I just love talking to people. Full stop. I love talking, as you can tell. I don't stop talking. But it was so nice talking to you and sort of seeing your perspective and sort of your career journey, and I like seeing people talk about what they enjoy.
Yeah.
And so you talking about your field, it shows that there's so many careers you can go into, and you will always find something you enjoy.
Yeah.
So if you guys can take away anything from this session, is that find what you enjoy, like she said, find something you're interested in and do it. Pursue your dreams, because you're gonna need to be happy with the career you choose. So choose carefully, and when you know what you want, go for it.
That's true. Totally agree with you. Yeah.
There we go. Some words of advice from the virtual room. So if that's it, I just want to say a huge thank you for coming to talk to us today.
You're
and thank you.
And
I hope you
to be here, and thank you so much for the whole Healthcare Careers Live for giving this opportunity. I mean, it's really nice to interact with people, and I've thoroughly enjoyed it.
Thank you. Likewise, it's really nice seeing people take the time out of their days to come and talk to us. Yeah. So I just wanted to say again, thank you. And I hope you have a brilliant rest of your Saturday.
Thank you.
Although it is over. But thank you very much.
Yeah, you too, take care. Thank you. Yeah.
Bye.